I like that aspect because it's looking at the whole child or the whole adult. I think that sometimes something can be so quickly it's taken for granted. Oh, well, the kid ADHD especially. It's like, oh, well, he just has a problem focusing and he has a problem staying because he's so intelligent. Well, then we don't look at some of these underlying causes that could help. Hi, friends and family, and welcome back to the Purple Couch Podcast. Today, we have a special guest, Dr. Cristi Salinas. Dr. Salinas is a neuropsychologist. So what does that mean? That means she specializes in diagnosing children and adults that may be vibrating just a little bit differently. Dr. Salinas is the neuropsychologist that I speak about in my book, So Can You Hear Me Now? If it was good enough for Loki, then I'll do my best to bring it to the nation. So I hope you enjoyed this version of the Purple Couch Podcast. We'll see you soon. Hi, welcome to the Purple Couch Podcast. I'm your host, Puzzle Box Pam. With me are my co-host, Missy Owen and Dr. Manny Rodriguez. Why are we here? Well, I'm a mom that got put on a mission. I have an amazing 18-year-old who was diagnosed with autism spectrum disorder when he was only 2.5 years old. We really knew something was going on by the time he was 1. But like everything in this world, only those that have access to the correct treatment plan or providers were able to tell me what was going on. So for the last decade, I've spent my life banging my drum and making sure that my child, as well as your children, have effective treatment and education that they deserve. This podcast is brought to you so that we can bring the knowledge of over a decade of some of the best experts in the field to your homes. Hi, friends and family, and welcome back to the Purple Couch Podcast. Like we had mentioned, today's guest is Dr. Cristi Salinas. Hi, Cristi.
Hi.
Cristi is not only a professional colleague, but she's also a friend. And I'd like to talk a little bit about her and make her blush just a little. When, as a mom in the field, I was looking for someone to give me some assistance to deep dive into my own son, especially because he had had an early diagnosis when he was 2. But by the time our kids are teenagers, they're night and day difference than what they were at 2. That's why I've been trying to tell all of our families to have hope. What they're going through right now is just a storm. So once the kids start to develop, it's always a great idea to have a professional be able to sit down, talk with them, and get some feedback. And Dr. Salinas has been amazing at that, not only just for my family, but for some of our families here at Puzzle Box. So we welcome you to the Purple Couch Podcast.
Oh, thank you so much for having me.
So tell us and our viewers just a little bit about yourself, especially the business that you run. I'm very proponent of us business women that are keeping our energy going, especially in what can be sometimes a man's world. So we're kind of paving the way for other females to see we can do this. We can get our energy out there. And it doesn't just have to be in that masculine side. We carry both energies with us, masculine and feminine. So Cristi also has her own business, which has a concierge service for those that are looking for neuropsychology services. Can you tell them a little bit about that?
Yeah, so I'm a neuropsychologist and I have Neuropsychology Concierge. I opened up in 2016 and we have offices in Suntree Vieira, which is in the Space Coast, Central Florida, and also in Winter Park, Florida. I'm also licensed outside of Florida, so in Massachusetts, Colorado, and also SIPACT, which is 37 states that I can serve. And we do a variety of diagnostic and treatment services for children, adults, and then their loved ones, their families.
Mm-hmm. So parents, if you do not have some of these services available in your backyard, I would definitely recommend giving Dr. Salinas a call. Like she said, she can reach not just here in Florida. And she's also a great person to call if you have those questions that fall outside of the realm of your teachers or your ABA therapist as well. To give our parents a little background, can you tell them the difference between a neuropsychologist and a psychologist?
Mm-hmm. Yeah, first I wanted to share about a psychologist because a lot of people don't know about that either. So, psychologists, really, we all psychologists and neuropsychologists typically have a doctorate degree in either clinical psychology, it can be school psychology as well. They may even have a neuroscience degree and a doctorate. During that doctorate training, we have coursework that we take and people's personalities and how to diagnose and how to treat various different conditions. And those are similar between a psychologist and a neuropsychologist. A neuropsychologist may take additional coursework in how the brain works, how you think, how your brain drives your behaviors. And we may take also additional assessment courses and different types of diagnostic techniques. The clinical training that we have, so all of us get clinical training, rotations that we do, may also be with more brain-based conditions or even conditions that are in your body, but we want to see how the medications or other treatments that you take may also affect your brain. So that may be medical things like asthma, diabetes, kidney disease, and how those conditions might affect your thinking, dementia. Also, obviously, neurodevelopmental conditions, because that's what we're thinking about here. So during your doctoral training as a neuropsychologist, you may get additional training not only in how to diagnose autism, but other conditions that come with autism. So that may be what I call autism plus. So that may be ADHD or executive functioning or memory conditions or even the higher risk of anxiety or depression. So we may add those things into a diagnostic assessment than in a typical psychology evaluation you may not have. The other thing is that when we all have to get an internship, it's 1 year, it's 2,000 hours. As a neuropsychologist, we have to do an additional fellowship. So that means that we have another year or another 2,000 hours of training, and that would be from a supervisor that is a neuropsychologist. Again, we're going to be working with also maybe children or adults that have autism, but they also may have medical diseases. So for example, in my case, I worked a lot with people that had epilepsy. So within that context, 30% of people with epilepsy have autism. So by default, over time, I became a specialist in autism because I saw thousands of people that had epilepsy and also had autism. So that's just one example. We may also see people with cancer or a brain tumor, but they also have autism.
Right.
So that is, again, the difference of who I'm seeing or why they're coming to me. But again, their behavior is still going to be assessed just like a psychologist, but we may look at the medical part too.
I like that aspect because it's looking at the whole child or the whole adult.
Mm-hmm.
I think that sometimes something can be so quickly it's taken for granted. Oh, well, the kid ADHD especially.
Mm-hmm.
It's like, oh, well, he just has a problem focusing and he has a problem staying because he's so intelligent. Well, then we don't look at some of these underlying causes that could help. Same thing with nutrition, things along those lines. And that's, again, going back to looking at the whole child. It's so important, moms and dads, that we have to not just look at the moment, but look at everything that led up to that moment. Especially because we're talking about autism and neurodevelopmental delays. And it's not just autism, because I think sometimes, like what you were saying, if we look generational, some of our diagnosing physicians that are out there don't have what I feel, and this is my personal opinion, is adequate training. I think that because right now we have so many children with neurodiversity, autism has become like ADD, ADHD was in the 1990s, and kind of a blanket, okay, well, he's on the spectrum or she's on the spectrum, just okay, here's the diagnosis, get on out of the office, go get some therapy, you'll be fine. Parents, I know what I'm going to say just rings home to you. Pay the extra dollars, okay? It's important. Get a true assessment of the child. We need to see everything about this little man, this little girl that's going on, and not just Band-Aids. You know, especially here, I don't know if you watched any of our podcast episodes. We really talk about whole child. Mm-hmm. It's so important, and not just putting a Band-Aid. so that we can find out, okay, what really is going on with Johnny? Okay, not that he had all this coffee or caffeine, because I've seen it now in the morning. Let's really find out what he needs.
Yeah, and I think that that's where neuropsychological evaluation is really helpful because we're not only looking for a diagnosis or just a label or a weakness. There's many strengths that come. And I think the most important thing is that every person is an individual first. And so, they're going to also present with autism in a unique way, just like I present in a unique way, or Pam, or, anybody else. And so, really we need to know like how they think, how do they feel, what's the thing that's bothering them. We need to listen to the child, ask them. So, I think I have a unique approach that I do interviews, and the parents are kind of sitting and waiting because I want to hear what their experience is. And through hearing their experience, I can know where their pain points are and what they're experiencing day to day, which tells me about their functioning or what they're most concerned with, so that they see how this evaluation is really going to help them. And it's going to help them with their goals, and that it's driven by them and not what I think, because, I'm a neuropsychologist. So I think the core part of an evaluation, or when we're meeting someone, is let them tell their story, listen to them. And that's really, they're going to tell you a lot of the times what's happening to them. And then we can use statistical or structured tests to help us gain objective data. Or, like I said, we can get additional data of what else may be going on that they didn't consider in the picture, so that we don't just think about right now, what's happening now, but as a provider, we can think about the future. What are their strengths, so that we can put something in place and nurture and hone that in, so that they can have a gift that we all uniquely have, but also what might be risk factors in that unique profile, or that person, or within their family system or community that might be a risk factor, like access to other people in the village. And if they don't have that, we can prepare, especially moms, because it's mostly moms who contact me, 99 out of 100 times. And so, they're prepared and they're at ease. And even though, yes, as one person put it, D-Day, diagnosis day, this isn't fun, Dr. Cristi, to be a neuropsychologist. I view it as, well, if you know kind of what you're facing, then you have a lot more information. And when you have that knowledge, it's really is power, right? Like people say, so you know what to face and what to do, and you have someone guiding you along the way. And that could be myself, that could be your family, that could be your friend, hopefully other providers in your community, because it's going to take a whole team to help you, not only now, but over a longer period of time.
Absolutely. I'm just sitting back in awe. Dr. Cristi helped me so much, even with my own son. Here it was, we have got Puzzle Box. I'm around some of the best BCBAs in the world. And yet even her insightfulness of sitting down with my own son and going through the diagnosis with him as a teenager opened up my mind. It opened up to how he brain maps, how he thinks of everything. So even when I would sit down and be able to coach him when he was doing his homework, it was a completely different approach, because he learns completely different than mommy. So then I had to do it in picture segments, and we did a lot of whiteboards, and we did a lot of, okay, let's put this in this circle over here. And then he could break it down himself. He's now 18 and he's doing this all on his own, but it was strategies in place, because this is a kid that didn't want to pick up a pencil, didn't want to write to save his soul. And now he's writing psychology papers. So it's strategies and having the right person. And sometimes that's not the aunt or the teacher. Sometimes we need to go a little bit more insightful, and we need someone that can give us a different direction from something that we have not looked at yet. Mm-hmm. Speaking of that, so can you tell our families, if they have a child that is in preschool or not getting ready to be in preschool, brand new baby to the family, are there things that you would tell parents to look out for, to when they should see, okay, maybe I need to talk to someone. Maybe I shouldn't trust Uncle Johnny down there that's telling me Charlie's going to do fine, When do you see these things that you would recommend to parents to say, okay, we need to sit down and evaluate, not get the diagnosis. Sometimes it's just an evaluation that's needed and a professional opinion to say, yes, I do recommend XYZ, or everything's okay, mom and dad. What would you recommend to our families?
Yeah. So I think specifically with autism, I've seen, symptoms even as young as 1. It could be 18 months to officially get a diagnosis to 2 years, but also it could be much later. So it's never too early. And I do tell parents, I think as a mom, we have a gut instinct and we know. And I can even tell you with my own son, that's a whole nother story, but that I saw many signs of many things earlier on from a sensory perspective, even nursing your child and whether they're able to do that around others or there's too many sensory components going on that are getting in your way, to how you are doing when you're doing your bath time, to, again, when it's holiday time now, and whether others can hold your child and pass them around the table or not, and how they're kind of smiling at you up in that high chair. And, are they wiggling and ready and smiling, or are they kind of not engaged in family dinner? So I think when you have a gut instinct as a parent, there will be people in, again, your village that may tell you different
Right.
things, and you may or may not listen to them. So what I would say, though, is you could always go to your first trusted people, which may be your best friend or your family member, but also you may go to your pediatrician if you have a good relationship with them. You may hear things like, wait and see. And that's very common. And again, depending on where you live, how many providers you have in your region. But I think it's really important, and I know that Pam is one of them. If you're a mom, don't just take the first message that someone tells you everything's okay if you feel like it's not. And sometimes parents don't want to have conflict with a professional, especially. So it's okay to get a second opinion. It's okay to go into somebody else. If you don't vibe with that provider, you can go to another person. So you can go to a developmental pediatrician. If you are in the Space Coast, we don't have developmental pediatricians. So you may need to go to another city. Might need to go to a licensed psychologist. You can find a neuropsychologist. But it's also important that those people may not live here. The good news is post-pandemic, there's also a lot of access now, virtual options, or again, you may have to travel, but it is a good investment now, earlier on, so that again, there's not a negative ripple effect. First, for your child, because the earlier the better, they get connected to the right resources. And also as a parent, because then now you know what to do. You feel like you can connect with your child, understand your child better, but also you have a lot less stress because you have more people to also connect with, and even other parent resources, other parents going through this once you actually know. So I think, again, just like anything else, though, in life, whether your child had a heart disease or they had cancer, or again, they have autism, you want to make sure that you're not alone doing that and try to navigate it.
You hit I literally was going to go into that question. I'm like, I've got some pre-made questions for Dr. Cristi, but I don't know how far we're going to get down those. When you mentioned the parents getting support too, so many times we've both seen it, that the child might have just got the D-Day, the diagnosis, but the parents are in crisis. Not the child. The child is still happy-go-lucky in his little world, playing with his Tonka trucks, and he is good to go. He doesn't care about anything around him. But mom and dad aren't. Mom and dad are in the panic mode. Oh my goodness, I just got this diagnosis. Oh my goodness, what is this going to mean for the rest of my life? And, I know you've seen it. I've seen it where I've talked to parents and the child's 6, 7 years old and they got diagnosed at 2 or 3 and they've not been out of their house since then. This is key, that community that she is speaking of. Again, it's not just your friends or your family around you. Talk to professionals because they can give you resources so that you're not alone, because the family is a unit. And I know Dr. Cristi personally, so I can tell you that she doesn't treat just that kid. She asks mom and dad on the intake, what is it that I can do? What can I work with you on? And that's a very key point when you're talking to other providers. Remember that you're part of that family unit. So like Pam, if it doesn't sound right, get a second opinion. If you don't vibe, get a second opinion. You can always say that no thank you bite, okay? Thank you so much. I really appreciate your time. And ding-a-ling-a-ling, what they used to call the yellow book. We know about that. Kids don't know about that anymore. So Google the next provider on the list, and ask them questions before you even go in. That's communication has to be two ways, because we've also seen it where the parents come in and they're completely isolated and they don't want to share any information. And then that's like pulling it out and like, okay, mom, is everything okay? And, sometimes the apple doesn't fall far from the tree. There are some things that Loki does. And he comes down the steps and he's like, yeah, mom, I'm just you. And I'm like, yes, you are. And we see that with all of our kids. That's also the biggest compliment we get, is when you can take a moment and you look at your child and go, that's me. Yeah, that's me. Or you see them with peers and you go, oh, that's also me. So those little things, trust the mom and dad gut. Trust what you're seeing, because you're with your children more than most people. And that doctor, that provider, that professional, that teacher only gets to see your child in a moment. So a lot of times our kids, especially here, we hear it from the parents. They're like, oh, Johnny's great when he's with you. But when he comes home, he is cussing and throwing his hands and kicking stuff over. And I'm like, well, is it in his room? Well, yeah. And I'm like, well, he's got it all bottled up. He was like, I got to be the good student when I'm at school, or when I'm out with mom at church, or when I'm at the grocery store. But when I'm home, I'm safe, I'm loved, and I'm comfortable, and I can be in my environment. So then we have to give mom some coaching skills on how to handle Johnny and be like, well, now you just need to get him into this mode so that you're both happy. So that's a very key component, is making sure that it's the family unit too. And that also, make sure grandma and grandpa and sisters and aunts and uncles are on the same page. Siblings. I get a lot of questions. And the reason that's kind of introing into this is I have a lot of families that may have a neurodiverse child and also a neurotypical child. Mm-hmm. And I hate that, because I don't think any of us are normal. I'm surely not normal. So you all can come over to my house anytime. But how do we talk to those siblings? From a neuropsychologist view and as a mom, what would you recommend to our parents, and how can we bring that unit together?
Mm-hmm. Yeah, I think that oftentimes the biggest stress is just labeling and thinking that when they have to talk to even their child or a sibling or any family member, that it's all about that they have to drop the A-bomb, let's say autism. But I think a lot of times it's just describing what that person is doing, just like we would do with anything else, right? At school, a child was, lying or didn't answer or wasn't paying attention. It's really labeling and describing, almost like a sports commentary, how when you watch a game that kind of is telling you what's happening, you would just share, you noticed how your brother or your sister does such and such, or how it's hard when we get to bed at night, if we change this other thing when we go on vacation. And they're like, oh yeah, that does happen. Okay, well, let's try this thing instead, just so that it's a little smoother and we can all go to bed happier. And that child will be like, oh yeah, I understand that. And so it's really about having a conversation and opening the door, and also asking their sibling what their pain points are. It's also, I think, another thing, and this is not just for autism specific, but other conditions that may be chronic. It's that maybe this child, again, depending on their severity, what the needs of the interventions are, it can be very time consuming, especially at certain stages, for this parent to have to drive or give up time, or maybe this other sibling isn't going to get to go to the sports or other events. And so I think that those are going to be the conversations that are going to be important. Absolutely. And why. But it's also prepping the sibling, depending on, again, the age range. There's so many varieties. I must think we could talk about this totally separate. So I want to be mindful of that. But it's important to know that the sibling may be an advocate in the future. So if they're an older sibling, it may be preparing them for how they're going to play an advocate role
Absolutely.
And it also depends on the age of the parents as well, and preparing them that as an adult, even, I have colleagues and other families I've worked with where the sibling becomes the guardian and over time. So it is also kind of letting them know what their roles are. So again, that's an ongoing conversation.
I really like
depends on the family
sportscaster.
system.
I never have thought about it in that aspect, but to sit down and to look at it as if you were doing a race or a football game or a basketball game, because kids can appreciate that and taking that instead of dropping the label. I love that. That really rings home to me because the label part is such a deterrent for so many people. And I'm like, well, just look at that as your game plan. I'm like, I really like that. I think that there's so much more that can be built on that. I really like that idea. So parents, you heard it here first. That's right. We'll be talking about that later on. Give me a couple months because that entire, I think we're going to have to do a sib shop. I think I'm going to have to run a sib shop, and that's siblings. It's what we do is it's a workshop that's just for the siblings of a child that has got neurodiversity. And, that could be more than just autism. That could be MS, that can be autism, that can be Down syndrome, epilepsy, could be diabetic. These are all little things that siblings that do not have these issues, and I don't want to call them issues, but irregularities or because it's a lifestyle.
Yeah, we don't want the sibling to see their sibling as just having a disease or a condition or a name. They're their sibling.
Right.
There's nobody else in the world out of 8 billion people that have that. So they don't really need to understand that. They just need to understand their brother or sister does ABC and how can I help them? And I also do ABC, and I bother and annoy my sibling the same way with my things that I do. And so, I think that's really important. And again, there's plenty of sibling programs around the country and models out there to do that. I've been part of that, especially in the epilepsy and neuro-oncology units. They do a lot of work with siblings of cancer. But you're right. I don't think there is as much in the autism and neurodiversity community. Another thing that comes up is with Down syndrome too, that there's also SIB programs for that. But yeah, thank you so much. And I hope this is helpful to people that have multiple kids out there.
Absolutely. So as we're wrapping up things today, which of course I'm going to have you back, if there were some advice that you would give to new parents, as a mom yourself, not just as a clinician, what words of wisdom could you give to those families?
I think, again, sticking with the positive aspects that, a lot of people, it's a marathon that you're going to be as a parent in general, but also with a person that may be neurodiverse or have autism spectrum. So we're not going to be able to, even if you come to a neuropsychologist and you have, a thorough treatment roadmap out there for the next 5 years, you're not going to be able to tackle it all today. We have to be sustainable in how we do it and what's going to be most beneficial, how to prioritize our time, how to still be a parent, how to have joy and interacting and still getting the joy of the stage that you're in, because it goes by in an instant, And so also seeing the growth, and sometimes that's hard to see. But I'll give you examples of even children that may be severe or nonverbal with autism. And I think I'm going to tie that to work that I've done with Pam. So, for example, I might see a child that's 2 or 3. They're not really speaking. They're having a lot of repetitive behaviors. They're climbing all over that mother in the waiting room. They've torn and broken all of this beautiful stuff on this table. But during that snapshot, I see that child look over and have joint attention with me. They look over at that plant while I pick it up. They may have a few moments there that I see that they are still aware that I am in the environment with them. And I know that in that moment, that I can put a magnifying glass there. So I'm always looking for what that child can do, not what the child can't do. And if I keep putting a magnifying glass there and I keep trying to reinforce that, and I set them up with an early intervention place, and they can get ABA services or they can get speech therapy as much as possible because they can make these vocalizations or they're almost doing word approximations, and they continue. The consistency is what's key. Then in 2-3 years time, it's amazing. Those children, they can come back, and I reevaluate these kids oftentimes, and they're starting to read. They're interacting with their peers. They're ready for kindergarten, And so it's because they talked with a professional that could see that that's where their child can be, and they have that hope and that trust in somebody that's seen this many times and down the line, that then they can go, okay, well, now what? Now we're ready for the next stage. So I think that, just keep, looking long-term, but also don't keep looking too far there because then you miss what's in front of you. And kind of keep having updates with people in your village so that you're prepared for the next new thing that comes, right? As soon as you feel prepared or your child makes growth, they may plateau, and then they or they change their mind, right? You're like, hey, this was working. It was working so wonderful. But now all of a sudden it's not working anymore. You may need to make an update. What else can I learn? And or that person was great and gave me lots of great tips, but they're not really the provider now for me on this. Maybe now I need help with social skills training, or I need help with parent education, or now you have to deal with advocacy with the school. Now they're a teen. Are they going to drive? Are you going to let them go to college? Are they ready for a roommate? So again, their needs are going to change just like every other parent and child have to manage. But it might just be a unique way. And you have to find the resources along those different stages so that you are prepared and so that they're prepared also. Ultimately, right, the questions I think we have as moms are, will our children, grow up and have friends or find love or get a job or, be fulfilled? And so I think that we'll have to listen to our children to find those strengths and gifts that they have. And the other thing is that there is an autism advantage. And I think that's the whole part of neurodiversity that people think of, which is that they may have a gift, like a restricted interest that they really like. And in mainstream, it may be football. They practice all the time and they become a pro football player. Here, they might be amazing at design or art or, something like that. And that might be a gift that they bring to community that somebody else wouldn't have done.
I love that. Oh, friends and families, I'm going to leave it right there. Autism is not a curse like we talked about last time. And in many cases, it is a gift. We just need to find what that special little present is for each one of our kids. So, from my family to yours, we'll see you next time on the Purple Couch Podcast.